everybody. My name is Somya Mandava, and welcome to the What the Health podcast, brought to you by the Alumni Association in conjunction with the Renaissance School of Medicine. Each episode, we bring on an outstanding alumnus who tells us what the health we can expect after graduating from medical school. From their journey to their interests to incorporating it into their chosen fields, we get to hear it all. So, let's jump right in. Hi, everyone, and welcome to the What the Health podcast. Today, our co-host is Christina Melian, and we have the pleasure of interviewing Dr. Hannah Elsevier, an orthopedic surgeon at UCSF and alumni of class of 2016. How are you doing today, Dr. Elsevier?
I'm doing great. How are you?
We are so excited to have you with us today. Could you please start off by telling us just a little bit about yourself?
Absolutely. So as you said, I'm a graduate of the class 2016. I did orthopedic surgery residency at Mount Sinai in Manhattan. And I'm now an orthopedic trauma fellow at UCSF here in San Francisco.
That's amazing. Thank you. So you said that you did an orthopedic surgery residency. What led to your interest in pursuing the field?
It was definitely not something that I planned for. When I was a third year, I actually wanted to do med peds. I was really interested in global health, and I thought that that would sort of naturally lead to a robust career in med peds, infectious disease, and global health. And then I did my third year clerkships, and my first block, I was like, oh, I liked my orthopedic surgeons when I had all my sports injuries. Why don't I just put ortho first? I've heard surgery is really hard. I want to get it out of the way. Block, I was like, this is the best. Third year clerkships are amazing. I'm never leaving the hospital. This is what I'm meant to do. And I thought that I just was so happy to no longer be doing the non-clinical or the preclinical things where you're just studying all day long. But then on my subsequent rotations, I kept circling back to orthopedics, and every subsequent rotation, like when I was on psych, I was like, oh, this is great. I don't have to be in until 9:30. I can round with the orthopedics team and then like quickly scrub a scope. And then I can go to my psych rotation. And at one point, one of the residents sort of pulled me aside and was like, there's something wrong with you. You're going into orthopedics. I was like, no, I just like it here. And they were like, no, nobody likes it like this. You do some research, you go into orthopedics.
Oh, that's terrific. I'm so happy you're able to find your niche. Can you walk us through what your schedule is like as a resident and kind of how it's changed, if at all, as an attending now?
Yeah, so there have been a lot of changes over time. So as an intern, you will sometimes be on nights, you'll sometimes be on days. When I was an intern, we didn't do 24-hour shifts. So as an intern, we had, sort of 12-hour, theoretical 12-hour time periods that we would be working. And then as a junior resident, things get considerably harder. So second and third year, you're doing 24-hour shifts, you're in-house, you're in the hospital, you have at least one pager when you're on call. And I would say probably across the country, the hardest time in orthopedic residency tends to be your second year. Because as an intern, you're just sort of learning things and people are fairly understanding. And then as a second year, you take on a lot of responsibility that's all very brand new. So you don't yet have the knowledge base that you necessarily would like to, but you're responsible for managing a lot of things. The good thing there is you have a lot of support from your seniors who also do 24-hour shifts, but at least at Sinai, our rotations were a little bit more comfortable. So we would have home call. So unless the junior resident needed you to come in for surgery or to come in to help with action, you could just field their consults or their questions from home. So you would be up at night, but you wouldn't necessarily be going into the hospital unless there was something that needed you. My schedule now is pretty similar, where a couple a month I'm on call and I'll be in the hospital during the day to do cases. Sometimes if there are emergencies because I'm in trauma, I'll also be going in the middle of the night. But with orthopedics, one of the things that's actually pretty nice is even though you do deal with emergencies, there are very few true orthopedic emergencies. So if someone has a pelvic ring injury and they're hemodynamically unstable, they'll come in the middle of the night to put an X-fix on. But even if someone has an open fracture at this point, the literature shows that you can just give them antibiotics and then slate them for first case, get a reasonable night's sleep, and do a great job fixing them at 8 o'clock in the morning.
That makes a lot of sense.
Yeah.
So being in such an involved field, what are some of the ways that you find work-life balance?
Well, so probably one of the craziest things that I have done from a lifestyle perspective is, as a second year resident, I sort of took stock of what my day-to-day life was. And I was like, this is not how I want to live my life. I go to sleep, I go to work, I go to sleep, I go to work. There isn't a whole lot of, joy and fun. And, I think of myself as someone who's athletic and outdoorsy. And I just was like eating cheese. So my friend and I went to brunch one day, and on the way back from brunch, we stopped at the ASPCA and I got a puppy. As a second year resident, which I definitely would not recommend to anyone. I spent the vast majority of my income paying walkers and dog sitters because, having a dog at a time when you're in the hospital for 24 hours straight, like every 3 days, every 2 days, is not easy. But one of my co-residents also really wanted a dog. And so we sort of shared the responsibility there. And she is the best part of my life now. I have no regrets. I'm so happy that I got her. Needless to say, work-life balance, I end up spending a lot of time with the dog at the beach. And then before coming to San Francisco, I met my partner, and we end up taking a lot of trips on the weekends and cooking together, having people over. Nothing really exciting, but just sort of decompressing together. And then, the San Francisco Bay Area is unbelievable. So we've been like going to Tahoe and Yosemite and Big Sur. It's really cool area.
Yeah, that's great. And I think it can be difficult to kind of find that balance between work and life. But it seems like you have a pretty good handle on it now, which is awesome. So kind of piggybacking off of that, can you talk a little bit about how your experience has been as a female in a traditionally male dominated field? And do you have any advice for any future students considering a similar path to you?
So that is a really good question. I think that was probably my biggest question or concern when I was going into orthopedics. I sort of looked around me and didn't see myself. So I saw that I was having fun, but I didn't see anyone who looked like me. I didn't see anyone who acted like me. And I sort of hadn't recognized my gender at all up until the point that I became a minority in the field. And then I suddenly started identifying, not that I hadn't identified as a woman before, but it didn't really carry as much weight. But once you experience being a minority, it is really impactful in terms of your ability to provide better care for people who are minorities that are unlike you. So when there was a whole Black Lives Matter movement, and some of my white colleagues may have said things that were insensitive, I was pretty quick to jump in because I knew from my experience being, the only woman in a room full of 35 men, that sometimes you don't feel comfortable saying that if you're the one who's a minority. And I think that the advice that I would give is find a mentor. It doesn't have to be a woman, but having someone in your corner who's a good fit is really, really important. And then one of the things that they've shown in the literature that has motivated women to go into orthopedics is just having a visible woman in the field. So if there is a female resident that you've interacted with, if there is a female attending, just their presence gives you that thing that I was looking for, where I was like, could I see myself doing this? Is there anyone here who I can identify with? So I think that trying to expose yourself to that through organizations like the Ruth Jackson Orthopedic Society, through the Perry Initiative, I think there are enough women in the field now that we definitely are a presence, and everyone is really welcoming. Everyone wants more women.
My experience was actually really similar to what you were describing, because when I did my orthopedic surgery rotation here, I was with a lot of the female surgeons, and they were always so warm, so open to teaching, very knowledgeable, very skilled. And it's so nice to hear how not only are there more women in the field, but they're also working hard to support and help other women join the field too. And kind of going off of that, in what ways do you think that increased diversity within the provider population would not only benefit patient care, but also benefit the field overall?
Yeah, so I touched on that really briefly. Just I think that having a diversity of perspective and experience makes it so that when you're having your post-op conferences, when you're discussing consults, you are not just coming at it from one perspective. You have other voices, you have other points of view. And, I think the literature on diversity in like Fortune 500 companies and tech shows that when you have a diverse leadership, you tend to be more financially successful. And I think part of that comes from having a progressive, more forward leadership in general, but also being able to not have one mind, one hive mind solving problems, but having little micro conflicts with your colleagues where you can say, oh, that's an interesting perspective. That's not what I thought. I thought this, instead of kind of bulldozing through one path all the time. And then having diversity within your group of attendings means that residents are going to feel more comfortable, and you'll have a more diverse group of residents, which means that the applicant pool to your program coming from medical school will be more diverse. So I think there are no downsides, and I think that encouraging diversity in all forms, it can be two people who look nearly identical, or the example of identical twins who were separated at birth. What you look like doesn't necessarily dictate what your experience has been and what your perspective will be. But I think that having diversity across the board is hugely important, especially in orthopedics, where we've been struggling for a little bit.
Right, and that's terrific. I mean, I think that you kind of hit the nail right on the head with diversity and the importance of it. Kind of shifting gears a little bit as we kind of wrap up the podcast. So can you talk a little bit about what some of your favorite parts of your job are, and maybe some of the most rewarding parts, or you can even talk about least favorite parts as well.
Yeah, absolutely. It's sad that we're doing this at the end because I could talk for the entire podcast about my favorite parts of this job. Um, so orthopedics in general is very rewarding from a hands-on perspective. I know that in your rotation, you probably saw that everyone's having a lot of fun. Um, so for the straightforward cases where you take someone who's having pain, who's having limited function, um, you are able to do something in a day that dramatically improves their life. And the process of doing that is also very rewarding. So if you don't like working with your hands, if you don't like using tools, then that's going to be miserable. You shouldn't do that. But most of the people that go into orthopedics, I think it's a challenging enough path that the people that do it are pretty sure that the day-to-day is rewarding. So we have a lot of fun. And the other part, more specifically the trauma side of things is, and it can be challenging as well. It's not all easy, but meeting someone on the worst day of their life and telling them, this is new for you. It's okay for you to be scared. This is what I do every day. The important thing is that I'm not scared and we're going to take really good care of you. That feels really good to do on a regular basis. And the fact that I get to, I think a lot of times people volunteer in order to get that feeling. So they go to work every day and then on the weekends or on their vacation, they'll do like a volunteer trip or something to get that feeling of saying, I'm giving everything that I know how to do to you to make your life better today. And I get to do that not just on a daily basis, but like many times a day. And, it doesn't always work out perfectly. Someone gets hit by a bus, you're going to put them back together the best you can. And they're still going to be looking at 6 months of physical therapy and intense rehab. But knowing that you're taking an x-ray where someone's pelvis, has completely broken open, and you close that down, you make it so that the general surgeons are able to fix up intra-abdominal injuries, and then you get them out of the ICU and functioning. It's really rewarding.
Thank you so much again for this.
Yeah,
is
thank you
so
both.
helpful.
Yes, thank you. It's lovely to meet you.
Yeah, nice to meet you both too. This has been really, really wonderful.
It really was all you. We're so happy we got to speak with you today. Thank you again for your time and all of your advice.
And please, again, don't hesitate to reach out. And thank you. Have a great day.
Thanks for tuning in to the What the Health podcast. Please be sure to check out our linked resources at the Stony Brook Medicine YouTube channel. See you next time.